Whether it's been representatives, whether it's been Dr. Rifi and his colleagues in the medical profession, our nurses, and we've got Faisal here as well, doing a fantastic job. And I want to thank everybody in our community who's getting out there, and we'll have a lot more to say. And I'd like to introduce you to Chris Minns, Labor leader.
Thank you, Soph. Well, thank you, Sophie, very much. Thank you, Dr. Rifi. I very much enjoyed watching Australian Story last night about your wonderful efforts in this part of Sydney at a very trying time. And we're here at the spiritual home of the Canterbury Bankstown Bulldogs, the greatest rugby league team in the history of sport. It's wonderful to be at this wonderful home of the Bulldogs. Look, first of all, I wanted to say thank you to Dr. Rifi, his amazing work on behalf of the people of New South Wales, his care for his community, and the innovative way that he approaches medicine and community care, putting up a tent in your front yard in order to make sure that vaccinations were distributed to so many people is an example of Australian ingenuity and world-class care. And Dr. Rifi, we're genuinely lucky to have you. He's been practicing medicine for so long that when he puts the vaccination needle in, you don't even feel it, or at least that's what his son tells me. But thank you, Dr. Rifi. It's wonderful to be here with you. Look, a few other issues that we want to cover off. Firstly, Parliament is due to return today. Every political party in the country, except for the Liberal Nationals in New South Wales, are not supporting Parliament returning. It's crucial, now more than ever, that we scrutinise government decisions and that the Premier and her senior ministers are available for questioning by the opposition, the crossbench, on behalf of the people of New South Wales, at a point when 2 million people are under curfew, 5 million people are under lockdown, and over 7 million people are at risk of getting COVID. Now more than ever, we need scrutiny of government decisions, and it's a platform for the government to explain the reasons for their policies and the impacts on the millions of people of New South Wales. So I'm urging the Premier, show some common sense, reverse the decision here. Let's bring Parliament back and re-establish that 11 o'clock press conferences. Another reason that the press conferences need to come back is because there is confusion around the future of the health orders, particularly as it relates to local government areas. We've got some senior frontbenchers and backbenchers calling for suburbs to be excised from the local government curfew area. We would say to the government, where is this up to? Is it based on health advice? What information are you processing? Front up to the media and explain your decisions. Not so that everybody can play gotcha with the New South Wales government or politics, but so that we can get a clear idea of the direction of the government and that the decisions that are being made can be scrutinised. It's crucial, now more than ever, that 11 o'clock press conferences come back and that the New South Wales Parliament return to sitting. Other than that, I'm happy to throw over to Dr. Rifi before we take some questions. Dr. Rifi.
Good morning, everyone. Thank you for being here. I have very good news to announce. We just got a message from the Commonwealth Department of Health. They have approved our drive-through vaccination clinic right here at the Bulldog Sports Ground. We will be operating Friday, Saturday and Sunday, and we are only limited by the amount of vaccine that we are allocated. And here is my message to our Premier. If she can actually allocate more vaccines for us on top of what the Commonwealth Government is giving us, we will be operating 7 days a week, not just 3 days. And at the same time, our constraint was financial constraint, thanks to the Canterbury Bankstown Council, thanks to the Bulldogs Leagues Club, and thanks for the SES for volunteering and giving financial support to cover the cost of the contractors and traffic controllers. All what we need now for New South Wales Health to assist us for the other days so we can vaccinate as many as we can in the shortest possible of time. In my clinic, it took us 5 months to vaccinate 10,000. But in the last 3 weeks, we vaccinated an additional 5,000. Having this drive-through, that means every week we can vaccinate probably 10,000. We just need the help and we need the vaccines. We need to open up at the same time with the rest of Sydney. Otherwise, social cohesion and social harmony is not going to be as strong as we would like it to be, because we have seen the discrepancy in the way that we are locked down while the rest of Sydney enjoying the beaches at Bondi. That's not fair. At the same time, we need to work very hard to vaccinate as many as we can in those affected local government area. What we have done before, it worked. But right now, there is a lot of people who are concerned of going indoors to be vaccinated because many others, unfortunately, they have been close contact because of the indoor space. We need to change the way we're doing things. We reached this goal very easily, but getting the last 20% from 70 to 80 and 90 is not gonna be as easy. So we need to be very innovative. Having this drive-through, it will meet people's demands, especially when we'll see the 12, 13, 14 years old, they need to be vaccinated. They're not gonna be coming on their own. They're gonna bring their mom, their dad, and their grandfather and grandmother. It's better for them to stay in their car, and it is safer for them, and it will be more effective for us to vaccinate the whole family in one go. So my message to the Premier of New South Wales, please look at this mode of vaccinating people. We're setting the standard in here, and we need some help, so please help us so we can, all of Sydney, end this lockup as soon as possible. One more thing, this curfew that we are under from 9 p.m. every day, it's not reasonable. We can work at 9 p.m. We can vaccinate people on 9 p.m. So please stop it because it's not helping anyone. Thank you.
Yep. Yeah. Yes, absolutely. Look, we've made this point yesterday, and I made it again today. People don't expect miracles from the government, and I think there's a high understanding that this is an uncertain time in New South Wales, but now more than ever, governments need to front up and explain what is going on, and that needs to happen in the daily press conferences and with Parliament. I mean, the key point with Parliament is politicians in New South Wales are still getting paid, and I think the public overwhelmingly expect us to work. And the Labor Party, the opposition, is desperate to work. We want Parliament to go back. We want to do our jobs. And if we're sending 15 and 16-year-old kids off to Coles and Woolworths to keep supermarkets open, then politicians should be going back to work as well.
Another point you mentioned today, there are calls within the Liberal Party, Liberal MPs, for restrictions to be applied to suburbs with the highest case numbers as opposed to LGAs as a whole. What's your party's stance?
Well, at the moment, it feels like a thought bubble from some government MPs and one frontbencher. We don't understand the circumstances in which people would be excised. I would say this, first things first, as Dr. Rifi has just said, lift the curfew. It's not based on the health advice. 2 million people that live in Western Sydney are subject to this restriction. There are local government areas that have very low case numbers that are in the curfew area. Directly across the street, the curfew doesn't apply. So let's start with that as a precursor to lifting conditions. Second point here is that millions of people have gotten vaccinated and heard the call of Dr. Rifi, the New South Wales Labor Party and the government itself to go and get vaccinated. If you get vaccinated, freedoms will return. That needs to be our direction and the government's direction going forward.
There's also calls within the Liberal Party. You know, we saw some pretty crowded scenes at Sydney's eastern beaches over the weekend for outdoor pools to be granted the same rules as beaches. What do you make of that?
Look, we've heard those calls. It needs to be done in a safe way. I hope the New South Wales Chief Health Officer is looking at the calls from Western Sydney mayors in relation to pools, particularly as the weather heats up. But my main point here is that if we're all in this together, freedoms need to be returned to vaccinated people, particularly in Western Sydney and southwestern Sydney. You shouldn't be a victim based on your geography, and that needs to be the way we go about easing restrictions right across Sydney. And one of the big reasons for this, and I think Dr. Rifi would agree, and I'm sure it's his lived experience, I know Sophie's told me this many times, is that the effect on the economy in the 12 locked up local government areas has been extreme. We've seen 1 in 6 jobs potentially at risk as a result of the lockdown, a 70% reduction in turnover for businesses in those 12 local government areas. So we could have an economic calamity off the back of the COVID restrictions. We need to do everything within our power to turn that around, and that's why the New South Wales opposition tomorrow will be holding an economic summit with business leaders from Western Sydney and South-Western Sydney to hear them directly and think of ways to lift up the economy in that part of Sydney and make sure that we can get through this together.
Speaking of those 12 LGAs, the Premier is today meeting with the mayors after many calls for her to do so. Has this happened too late?
Yeah. Well, look, you'd be aware the mayors have been repeatedly calling on the Premier to have a meeting with them. They've been screaming that their communities are hurting and that there's a different set of rules applying to their community, to the rest of Sydney. Finally, she's agreed, but it's very late in the game. I mean, my hope is that she listens to the mayors, that they impart to her what their communities are going through, and that we have an economic plan to lift up those economies, because once lockdowns are lifted, other things will come on the agenda, and New South Wales Labor in particular will not forget Western Sydney and South-Western Sydney.
Another sector feeling the economic brunt of COVID is, of course, the hospitality industry. There are some confusions, I suppose, around mandatory vaccinations for staff, who they're allowed to serve and whatnot. What's your thoughts?
Well, look, our thoughts are with those restaurants who have unambiguously said, go and get vaccinated, listen to the government's warnings and instructions in relation to this so that we can open up Sydney. And I think that the abuse that's been levelled at some of them over the last 3 days has been appalling. I mean, these people want to open their businesses, they want to do it in a safe way, they want to make sure that their staff and their customers are not infected with this horrible disease, but there's also a recognition that they want to get back to normality. So it's still the best way forward in terms of vaccine passports and a plan to open up in a safe way. The alternative is too grim to bear, and we can't have lockdowns all the way up to Christmas because it's hurting too many people.
Is there more clarity needed for the sector though? Who should be making those decisions with, who they serve and their staff? Should it be the individual business or should there be a public health order?
Well, look, at the end of the day, the public health orders are going to have to drive behaviour in relation to this, and businesses are right to be concerned about how this will be rolled out. But that just gives more impetus, in my view, to have these daily press conferences, because you can't lay down rules that will affect tens of thousands of businesses, catch up 7 million people in its net, and then not explain the application of those rules over the coming weeks. So the Premier needs to reverse her decision on this. We don't expect the government to have all the answers, but we do expect them to be available for questions. That's it. Thank you.
I might just ask Dr. Reefy a question, if that's okay. My name's Cecilia, lovely to meet you.
Thank you, Cecilia.
So just clarification around the drive-through clinic. You said that that was going to be operating 3 days.
Yes.
Is that a 3-day pop-up clinic or is it 3 days on a weekly basis?
Now, it's going to be operating 3 days for the next 6 weeks. And Friday, Saturday and Sunday, this week, next week and after, till the end of October.
This is something that you have mentioned, but what are vaccination rates in this area in terms of first dose and those that are fully vaccinated?
To be honest, I think from seeing the reaction of patients that I used to call and encourage and spend long time to convince, I reckon the Delta strain have made the call, made everyone to come in, seek the vaccination, because they saw their loved one, their neighbors and others ending up very sick or in hospital or in ICU. We don't need to send any more messages. We just need to get more vaccines because the demand far outweighs the supply.
One of the things you mentioned is that you're calling for the curfew to be lifted so you can operate this clinic for longer hours. How important is that for this community, being able to operate beyond 9 p.m. given their, workplaces and lifestyle and other factors?
A lot of workers in the area, they work long hours, morning to early evening. They wanted to get their second shot, and unfortunately they can't get it neither Saturday or Sunday, and they can't get it at night. And lifting the lockdown, that means will enable many of lifting the curfew will enable many of GPs to provide their services late at night, and at the same time having a drive-through on the weekend will enable those workers to have their second shot sooner rather than later and without their disruption to their income. Thank you. Well, probably I'll just say one thing. If it is safe for Queensland to be here having this press conference, I think there is nothing to prevent the Premier herself from coming around to this area and seeing firsthand what's been happening here. Chris mentioned about the economic aspect and the impact in this area. But let me tell you, there is a heavier price that we are paying, and that is the mental effect on a lot of our people. First of all, the frontliners like myself, other GPs and workers that they are doing and working under difficult circumstances. And I reckon actually the Premier should hear their voices.
Thanks.
Thank you.
Thanks, everybody.